Hello and welcome to EastMojo My Report, where we bring you all the latest happenings and the developments from the east and northeast of India. This is Chandan Pandit, Tripura correspondent, and today I will be your host. So, just to begin with, we are also joined by our state correspondents from Nagaland. We have Madhu joining us, we have Sally joining us from Manipur. So, first we'll go to Madhuliana, where she will be giving us the COVID updates for the day from Nagaland. So, what's the current status in Nagaland, Madhu?
Yes, Chandan. Today we've seen, the highest single day spike in the state. That is, a total of 310 new cases being detected from the state. The last single day highest spike was in August when over 200 of them were tested positive. But this time we've seen that over 300 has tested positive. And with the addition of these 310 new cases that have been reported here in the state today, our state is nearing the 5,000 mark. Among the new cases, I'd like to give the, the segregation, the breakout as per the district wise. So this is the official information that we've received from the Health and Family Welfare Minister. He's
Right.
informed that out of the 310 new cases reported here in the state of Nagaland today, a total of 176 are from Dimapur, 127 new cases are from Kohima, 3 are from Zunheboto, and one each is from Woka, Peran, Mon, and Mokokchung. So that's a total of 310 new cases. And also, this new cases, the 310 of them have been declared as positive out of 922 samples that were tested. And the minister informed that necessary contact tracing has been fully activated. Also, with the addition of this 310 new cases, like I was mentioning earlier, the state's total number of confirmed cases is nearing the 5,000 mark, and it currently stands at 4,946. Short by some few numbers now. And the current active case is at 1,144. The current recovered status is at 3,781. Nagaland has also reported 8 confirmed deaths, COVID-19 deaths, and besides that, 11 persons have migrated. Now, as I speak about, the breakout of the cases, I'd also like to mention that we yet to receive the official update if there has been any new recovered cases today. In case, there are more recovered cases, the recovery rate, which was at 80%, over 80%, will also increase. However, even though we have seen a record spike in number of cases today, the number of recovered cases continues to surpass the number of active cases. We are also still unable to ascertain the segregation of the sector-wise distribution of these new cases. And as per yesterday's update that I have, I'd just like to quickly mention that over 45% of the cases are from the armed forces personnel. 29 of the cases are true returnees or travelers. Contact tracing is at 19%, 19%, and frontline workers who tested positive comprise of 7% of the total confirmed cases. So far, COVID-19 status is concerned, this is the latest update that we have from Nagaland. Chandan.
Yeah. Thank you, Madhu, for that COVID update from Nagaland. So now I'll be giving you the COVID updates from Assam since Simran is not joining us today from there. So Assam has so far reported a total of 1,35,805 confirmed COVID-19 case. This includes a total of 29,687 active cases in the state. This also has the number of people who have so far recovered from this virus stands at 1,55,701, while the number of COVID-related death has increased further with more 50 deaths, and now it stands at 414 deaths, while the number of persons who migrated from the state has increased with one more person at 3. So this is something coming out of Assam. Also to inform you that uh, very recently we have seen that most of the state had started plasma therapy, but recently a report published by most of the media houses and also the ICMR has confirmed that the plasma therapy is not working the way it should have worked. So this is something alarming for the states like Assam and Tripura, which were planning to start plasma therapy, and Assam has already started that. So the news coming from there in Delhi that the plasma therapy is not effective will certainly give a blow to both the states since they were planning to start the plasma therapy in a larger scale. So this is something coming from Assam. Now I will go to Sally, but before going to Sally, I will be giving you the updates for the other state. I'll be giving you the updates for Mizoram, how much numbers Mizoram has confirmed that Meadow will be giving us, sorry. So now I'll be giving you the updates for Tripura. Tripura has so far reported a total of 17,830 confirmed COVID-19 case. This also includes a total of 10,255 recovered case, while the number of active cases in state now has further surged and it stands at 7,381. The number of COVID-19 deaths has further increased, and now the number of deaths in the state has uh, stands at 172, while the number of persons who tested positive and later migrated from here stands at 22. Just to give a overview of the COVID situation in Tripura right now, we have been covering a lot about the COVID-19 and the happenings in the state. Tripura has reported more than 172 COVID deaths. This is the data that was provided last evening by the Tripura Health Department Media Bulletin. So just to inform our viewers that in a state like Tripura, where more than 172% have succumbed to this virus, a number of political leaders, stakeholders, and others have already started questioning the role of the government and the mismanagement. And just to give the latest updates regarding the COVID-19 status in state, Tripura High Court was hearing a case today, a suo motu case they took based on the media reports published in local newspapers and other media websites. The High Court division bench comprising of Chief Justice A. Qureshi and S. Talapatra, Justice Talapatra, they both heard the case this morning, and where the Advocate General Arun Kanti Bhumik was present. The Chief Justice questioned what is the present status of the state government, how they are planning to fight the COVID-19 virus. The Chief Justice also observed that the state has reported a sudden spike in the COVID-19 case. The bench, the division bench also said that how far the government is planning to tackle this virus, and the number of ventilators which should have been distributed among all the district hospitals was not done so far. A four-page order copy of the High Court, which comprises of 8 questions sent to the state government, has questioned a lot of things to the government, which I'll be giving you later. But now I'll go to Sally to get the COVID updates for the day from Manipur. Sally.
Thank you so much, Chandan. Yes, in the last 24 hours, another 109 new cases has been emerged as COVID-19 patients, out of which 8 are from the security personnel and 101 are the locals. From it's mostly from the trace contacts. So yes, the total COVID-19 confirmed cases in Manipur stands at 7,579. Along with the new fresh cases, another 204 infected persons have been discharged from the hospitals. So the recovery rate stands at 79.19. This is today's recovery rate. That is 79.19%. And also the total recovered patients has now increased to 6,002. So right now, 1,533 COVID patients are receiving treatment at various COVID care centers and the hospitals, of which 1,231 are from the general populations and 302 are the security personnel from the Central Armed Forces. And today, in the last 24 hours, there are no death report related to the COVID-19. But unfortunately, yesterday, 4 new death cases were reported, including 1 security forces from Churachandpur district. So right now, the Bantamik, when it comes to the death tolls of Bantamik, it has reached up to 44 death tolls in the state. So this is the latest report when it comes to COVID-19 from Manipur. Chandan.
Right, Sally. There is also a news coming in from Manipur that 28 Congress members has joined BJP. What is it all about, and does it comprise of any high leader, prominent leader?
Well, yes, the news just came in when we started the live report that 28 members of the Singhat Assembly constituency, which is led by its president, Mr. Hangao Pao, and vice president as well as a treasury. So the 28 members from the Congress party, in fact, they are the opposition party here in Manipur. Now they have joined the Congress party this evening, and they were facilitated at the Chief Minister's Secretariat home. And this 29th, in fact, the Baipul, the upcoming Baipul is already started for the campaigning, though they have not announced the specific date for the 13 seats, which will be held likely by next month. This is what we have the information. But right now, we have not got official information regarding the upcoming Baipul as well as for the ADC elections. But the latest report for the new members joining to the BJP, the ruling party here in Manipur, are the 28 members from the Congress party from Singhat Assembly constituency. Chandan.
Right. So this is a big blow, yet another for the Congress party. We have also seen earlier last month there was a trust vote in the assembly which BJP won with a good majority. So how do you see the overall political situation in the state of Manipur, where the opposition leaders are one after another are changing their wings and they're now going to the Saffron party? How do you see the overall situation in the state now?
Well, yes, initially when the NPP, which is one of the allied party here in Manipur, when they withdrew their support to PJP, that happens a few months back, definitely there was a high chances of the opposition party coming back, forming the Congress, forming the government. But then later on, when the NPP decided to, support the PJP party, after that, another 9 Congress MLA were, resigned from the membership of the Congress and then rejoining the BJP party. So it looks like, since there are lots of against towards the ruling party, but at the same time, more Congress party members, especially the MLAs, are rejoining with the BJP party. So it seems like, for the upcoming Paipul election as well as for the ADC, it looks like the BJP, the ruling party, as well as its allies, regional party, have high chances for this upcoming elections. Chandan.
Right. So as just Sally mentioned that yeah, ADC elections are going to be very crucial, since we know most of the autonomous district councils in the northeastern states are yet to go on pause because due to this COVID-19 pandemic, the elections were deferred for indefinite period. So we hope that by the time elections are announced, these parties changing over from one place to other will be finally sorted out. So now I'll be going back to uh, I'll be going back to Meadow to get the updates from Mizoram. She'll be giving us the COVID update for Mizoram today.
Oh, well, Chandan, so far the state of Mizoram is concerned. They have reported a total of 1,353 COVID-19 cases. Out of this, 563 of them are active cases, and 790 are COVID patients who have been discharged. So, in this state of Mizoram, we see that there is no death cases, fortunately, so far, and the number of recovered cases also is above, slightly above the number of active cases. And like the state of Nagaland, here in Mizoram as well, male, the number of COVID patients are more among the male as compared to those of the female. A total of, out of the total of 1,353 who tested positive, 1,122 of them are male, and the rest, 231 of them are female. And as per the district-wise data that we've received, Aizawl continues to be the highest among all districts. It currently has 424 active cases, and its discharge is also slightly higher than the number of its active cases. So, well, Aizawl has 424 active cases. It has 463 recovered cases. Aizawl is also followed by Kolasip with a total of 103 current active cases. Besides the current active cases, a total of 100 of them have recovered from Kolasip. Um, so far the segregation as per the sector wise is concerned, we see that over 60%, precisely 60.74% of the total confirmed cases comprises of civilians and others, and a total of 16.52% are of truckers. And we see, most armed forces testing positive for COVID-19 in most of the northeastern states, including Nagaland. Here in Mizoram also, we see that total of 22.73 of the total confirmed cases is comprised of the armed force personnel, which includes the Assam Rifles and the NDR, the BSF, CRPF, the Indian armies. This is inclusive of the BROs and the BRTF. So far, the state of Mizoram is concerned. This is the latest information that we have for today. Chandan.
Right. Thank you, madam, for the COVID-19 updates from Mizoram. So now I'll be going back to Irani since she has joined us from Itanagar. So we'll get the COVID updates for the day from Arunachal Pradesh. Irani, you there? I think there are some technical
Yeah,
issues.
yeah, hi,
Yeah.
Chandan.
Yes.
The
Yes, Irani.
network
So
is
could you
very,
please?
very bad here, so
Yeah.
yeah, that's the
Yeah.
reason. So yeah, if you
Still with.
talk about the COVID-19 update from Arunachal Pradesh, uh, as usual, capital complex is still at the top with 369 cases and 1,291 people have recovered. West Siang, which is in the second, if you look into the list, which was provided by the health department yesterday. So West Siang has 223 active cases so far, with 80 people uh, recovery from the COVID-19. And if you look into the overall data of the state, there are 1,658 active cases. Uh, 4,005 people have already recovered, and with 9 deaths, the state tally is at 5,672. And Chandan, I also would like to, inform our viewers about a news which is really making headlines, not only in the state but in the national arena. It is about the Chief Minister. So the Chief Minister of Arunachal Pradesh, Mr. Pema Khandu's trek of 11 hours on the foothills of Himalaya is not only making headlines but also setting an example for the lawmakers in the country. So Mr. Khandu trekked for about 11 hours at a height of 14,500 feet through mountains and forests to meet the
Right.
villagers of Luguthang. So Luguthang is a village which falls under the Mukto constituency in Tawang district and shares its borders with China and Bhutan. And the journey of the village is, however, a mesmerizing one, as we can see in the video which was posted in his Twitter page. And one has to cross the eye-catching Karpula mountain, which is about 16,000 feet above the sea level, and several enchanting natural lakes that falls on the way to the hamlet. The village is about 97 kilometers away from Tawang, which is very famous. If you look into the list of tourist destinations in India, Tawang is really very famous. So Tawang and this village is located in Mukto constituency, which is Mr. Pema Khandu's constituency, and he was accompanied by his brother, who is MLA of Tawang, Mr. Shirin Tashi, and they also attended the consecration of Jangchup Stupa the next day, and the stupa has been erected in the name of Khandu's father and former Chief Minister, late Dorji Khandu.
Right.
Chandan.
Right. Thank you, Irani, for that update. Indeed, this is a great example for all the lawmakers how a chief minister trick for hours to reach the people of their state and to get the live detail from them, to hear their apathies, to hear their concern, what the government can do. Just to understand from you, Irani, we know the geographical area and the map of Arunachal Pradesh, how difficult it is for one person to reach some of the villages which are in the remotest area. So, how do you see the enthusiasm of the Chief Minister of Arunachal Pradesh?
Uh, if you talk about, yeah, the road connectivity in the state of Arunachal Pradesh is really very poor, and there are a few places where the roads didn't reach yet, or the electricity didn't reach. There are many villages in the state, but if you talk about the hilly part, I mean the snow-capped mountains and the villages are situated in between those snow-capped mountains. If you talk about those areas, then we cannot forget about Tawang and Shiomi district.
Right,
Shiomi district, which was recently created. Otherwise, the well-known name from the Shiomi district is the district headquarters, which is known as Mechuka. And
right,
Mechuka is famous for the adventure festival. And yeah, so coming back to the mountainous treks, as I have already mentioned, that Mr. Pema Khandu's constituency, which is Mukto, and villages, there are many villages where few families are like this. This village where only 10 to 15 families are there, but the lawmaker or the political leader or any leader have to travel around 15 hours at a stretch to reach those villages. So you know, I know that Pema Khandu can send any of his executives or representatives to meet those villagers, but he went by himself. He trekked for about 11 hours for, covering a distance of around 24 kilometers to reach those villagers and to ask them whether they are happy, whether whether the schemes, the flagship programs of Government of India are reaching there or not. So that's the enthusiasm, and he's doing a quite good job in this front. Chandan.
Right. Right. Thank you, Rani. Thank you for that update from Itanagar. So indeed, it's a good news coming in from Arunachal Pradesh, where we often see that the flagship schemes from the government hardly reach to the villagers at the grassroots level. But here, like a chief minister, Prema Khandu, he himself ensures that all the schemes and the benefits which are meant for the people reaches them. So this is indeed a great news coming in from there. Now I'll be going back to Sally in Manipur. She will be giving us the other update which is coming in, that the government is still yet to plan about reopening of school. Although the Ministry of Education has recently given its SOP how the schools can be reopened and the other details which Sally will be giving us. Sally.
Yeah, thank you so much once again, Chandan. Yeah, in regards to the latest SOP issued by the Ministry of Health and Family Welfare's or on the reopening of schools, so there were a lot of confusions and tensions among the students, the parents, as well as the teachers fraternity, because during the pandemic, during the COVID time, sending their kids to the schools is kind of taking a risk as well. So there were a lot of confusion and tensions, and today the Education Minister, Mr. Ratesham Singh, had called a press conference and informed, as well as, in fact, clarified to such misinformation that has been circulating in a couple of days, that still now the state government have not decided when it comes to the reopening of schools and colleges. But yes, definitely, as per the SOP which was issued by the Ministry of Health and Family Welfare's, these are in regards to the partial reopenings, which means, for those students studying between class 9 to class 12, if they are voluntarily wanted to, go to the schools and then to seek opinions or seek their doubts to the teachers, they can do so. But this is not about, reassumption of the regular classes. That's what he had clearly clarified today. As well as, even though the students who are voluntarily wanted to go back to the schools without a consent, without a written consent of their parents, that's what he clearly mentioned, then they would not be allowed entering the schools. So yes, definitely, though there are lots of misinformation, in fact, a lot of rumors that's happening here that the schools will be opening from the September 21st. The state department, the education minister had clearly clarified that the state government have not yet decided when it comes to reopening of schools. In fact, yeah, since the pandemic started and since the closure of schools and colleges in the state department, the education department had initiated, like the other state, for the online classes for the students as well, both the government schools as well as the private schools. But there were also like a lot of reports of students who are mainly staying in the remote areas, and given the given the weathers over here, a lot of internet connectivity issues are here. So most students who are staying in the hilly areas do not have much access to the online classes, even though the schools are providing such services. So given on this situation, the state government, in fact, the education department, have been to closely keep in touch with all the stakeholders, including the CSOs, student leaders, as well as the principals, the school principals, both the government and the private school, on the preparedness when it comes to the reopening of schools. But he had clearly mentioned that the SOP would be given out by the ministry from the center government accordingly, as per the decision, as per the decision taken by the chief ministers. They will accordingly they would be announced the reopening of schools. But till now, no such decision has made. That's what he had clearly clarified on today's media conference. On top of that, there were a lot of schools and colleges they were used during the quarantine standards when the returnees started coming back from various metro cities. But today, the education minister had said that all the schools and the colleges that was used for the quarantine centers has been cleared and sanitized, which means it's all ready when it comes to reopening of schools. So yes, the schools, when it comes to the infrastructure, sanitization is all being done. Only the state government needs to have proper SOPs when it comes to reopening of schools. So this is all I have when it comes to the education from Manipur. Chandan.
Right. Thank you so much, Sadly, for that update from Manipur. So now I'll be going to Meghalaya, where Princess is waiting to give us the COVID updates for the day. So, what you have got today for the day, Princess?
Hi, a very good evening, Chandan.
Yes.
So, for the COVID updates that we have for today, we have once again, we're looking at a spike of COVID 19 cases. For today, uh, Friday, we have seen a total of 151 active cases was recorded for the day. Now, once again, uh, East, East Khasi Hills is, topping the list in these high risk in these COVID-19 cases with the highest stands at 161. Now, before I get into all the details, I'll just begin with what's quite alarming right now is concerning the deaths. We have once again seen and just got the information that a total of 4 new deaths have been recorded in the state of Meghalaya. Now, with these 4 deaths, the total deaths in the state of Meghalaya now stands at 24. Remember that till yesterday we were at 20, but today we have recorded fresh new deaths, which takes to 24. Now, just a brief, just a brief summary of these deaths that we've recorded, and mostly all these deaths are all ranging from ages above 40 years old. Like we have one of the patient who was above 46 years, another is a 45-year-old, and another is a 40-year-old. If we are looking at these charts of deaths happening in the state, and these are all comorbid. They had comorbidities.
Right.
So if we look, and also uh, these patients, like one is from Andhra Pradesh, who was admitted here, who was in Meghalaya, was admitted at civil hospital here in Shillong on 4th September. And on 4th itself, he was tested for through an RT-PCR, and he was tested positive. But it was today at 10. I'm sorry, on the 10th of September at 10:40 p.m. The patient passed away, succumbed to COVID-19. So now, just getting back to the figures, the total. Now, I'll just give you a total figure of the total cases in Meghalaya stands at
Right.
1,539, and the total recovered is 1,889. And like I mentioned, the deaths in the state stands at 24. Chandan.
Right. So, Princess, when you talk about the fresh case and a sudden surge in this COVID-19 deaths, so is there any chance that in Meghalaya, like we have seen in Tripura, though the government doesn't admit that community transmission has already started? So, do you think has the government confirmed that community transmission has started in Meghalaya, or are there any chances that if the government doesn't take any measures right now, there will be community transmission soon?
Well, Chandan, if we talk about community transmission, in the very first instance itself, after, if you remember, the most biggest fiasco that happened in our state, we are talking about the 43 attendants who went for a wedding to Khanapara. Following that incident, we kept looking at the cases rising in the state. So from there itself, we already questioned the government that Are we seeing a community transmission? Because every day cases are rising day by day. Earlier, the cases that we had seen was just from 10 to 15, but now every day it's always above 100. So yes, the deputy chief minister of Meghalaya, that is Preston Tinsong, in his last briefing, he did say that they're looking at spread of community transmission is happening right now, and they had cautioned all their citizens of the state also to follow the health protocols, to maintain social distancing. And remember, micro containment zones are also happening, and also the deputy commissioner of every district, when they see that there's overcrowding or where people are flouting all the health protocols, immediately the place is being shut down, or they're asked to close the shutters down, because if they violate the protocols, then it's all in vain when the government is trying to fight this virus. And also I wanted to inform, as today we're yet to publish the story on the website, but according to a report that I visited Civil Hospital Shillong, I've interacted with a few of the people who are high risk contacts. Like in their family somebody had tested positive. Now what they're supposed to do is they're asked to go to civil hospital. Like there's a vehicle that fetches them from home, brings them to civil hospital here in Shillong. Now what's very alarming is that this patient here or this contact who had spoken to me today, she's an elderly woman who's above her 40s and has diabetes. So she's saying that she's been waiting for over 4 hours wanting to get her tests done. So we're looking here that yes, the government also did acknowledge that there is a lack of manpower in the state. Hence that decision, if you remember, that the state decided to close down all the entrances to Shillong from
Right.
October, November. So this is what is happening in the state.
Right. Thank you, Princess, for that update from Meghalaya. So this is it coming in from Meghalaya for the day. And now, before we sign off, I was just about to give you the COVID updates, where I also mentioned about the notice being served to the Tripura government by the Tripura High Court. So the division bench, comprising of Chief Justice A. Qureshi and Justice Shubhasish Salapatra, they observed that the state has registered a number of cases in the last 1 month's time. They also said that the state government has somewhere failed to manage, although they said that the government should provide the details to the High Court within a week's time. They sent a letter to the state government, a notice rather, I would say, which has 8 questions to the government, which the court seeks a reply from the state government. This includes the number of active corona cases in the state, if possible, with district breakup. So, just to inform our viewers, that Tripura has presently 8 districts. In Tripura, we have 8 districts. The second question, which the High Court has questioned the state government, is the number of corona treatment center with breakup, which are fully equipped with necessary infrastructure, medicine, medical, and paramedical staff. To inform our viewers that Tripura has only one COVID-19 hospital, that is Govind Ballabh Pant Hospital in Agartala, also the main referral hospital of Tripura. So this is the only COVID hospital, although we have COVID care center in all the districts where patients are undergoing treatment, and the government had recently decided that 2 of the COVID care centers will be now working as dedicated health center, where the facility of oxygen oximeter and ventilation will also be provided. Although how far the work has been implemented is yet to be known from the states part, since we are not getting any press conference for the last 2 weeks probably by the state government. Whatever we get is in the evening we get a press release or a media bulletin rather, I'd say, which gives us the total breakup of the number of positive case deaths and the number of samples collected so far. So which is not sufficient for us to file a report on based on the media bulletin. So we have to wait for a press conference by the health minister, that is the chief minister, or somebody who is authorized to speak on the COVID-19 virus. The third question which the High Court has questioned to Tripura government is whether there is any private hospital in the state which has been given permission to admit coronavirus patient. If yes, the maximum capacity of such hospital to admit such patient, and the treatment charges which these hospitals have been authorized by the government to collect. And to inform that recently the chief minister had held a meeting with the private hospital and the nursing home staff, where he said that the ILS hospital, which is the only private hospital after GBP, which has the modern infrastructure and all the latest technologies which is available in the state. So the government had allowed them to admit COVID patients. So I think this will be replied by the government in due time. The fourth question, I'll just give the gist of it. Some newspaper articles have reported of about lack of communication between the COVID-19 positive patient and their family members. So we know that once somebody is tested positive and he's in COVID ward, he's not allowed to meet with his family members. Although in most of the states, what we have seen is that telemedicine system was introduced. Even Tripura had planned that they will start telemedicine and they will help the family members interact with their family person who are undergoing treatment. So this is something the High Court has sought clarity from the state government. The next question which the government has to answer is the affidavit shall also provide details of fund allocation at different government hospital treating corona patient, the breakup of the fund available for corona treatment and treatment for other element to be provided. This is the question which the High Court has sought sent to the government. And the next question is the availability of PPE kits and other equipments for the COVID warriors. So this is very crucial question. We know to fight against the virus, we need the PPE kit for the frontline workers, especially the medical staff who are working 24 into 7 to save the lives. Although Tripura has reported so far more than 172 COVID-19 deaths, but the way the mismanagement and allegation has come against the government, the High Court has taken collegium of this media report and they have sent this 8 question. The last question which the High Court has asked the state government is we are sure the government would address to the coronavirus concern of the general public as are projected by the print media and take such measures as are necessary to improve the condition of government treatment center. So just to inform that recently the opposition leader, in fact, the former health minister, Mr. Shudip Rai Burman, he visited the state's lone COVID hospital, Govind Ballabh Pant Hospital, and he questioned the management being run by the state government and the present health minister, Mr. Biplab Deb. So this is something that the High Court has also seen in some of the media reports and a number of questions and the social media posts where we have seen the keens of the COVID-19 victim alleging that their family members died due to shortage of oxygen cylinders, due to mismanagement and for the doctors not attending the patient for more than 24 hours. So this is something which the High Court wants a clarification from the state government. We hope that by a week's time, the state government will submit its affidavit in front of the High Court, and maybe we can file a report on it. And the about the notice served to the High Court, the copy will be shortly live on our website. You can visit us at www.eastmojo.com. So this is a wrap from the northeastern state. All the things that we have discussed so far is live or will be live shortly on our website. And if you come across anything that you think it's fishy, you can send it across to East Mojo. We will get you the other side of the story. Send it across at editors@eastmojo.com. We will get you the facts identified and then we'll send you the real fact behind anything that you think is fishy. And also request our viewers to like, subscribe, and press the bell icon to get all the latest videos and the posts that we keep on posting in our social media platforms. Before we sign off, I would request our viewers to wear your masks, use sanitizer, and stay at home unless it is not very much urgent to go out of your house. This was Chandan Pandey from Agartala. Remember, it's eastmojo.com.